Hey everyone, I'm Dr. Shopovick at Now Hear This, and since September is Healthy Aging Month and October is Audiology Awareness Month, I wanted to take a deeper dive into hearing and hearing loss and how it declines as we age, or I like to say as we grow up. So first I want to show you this graph here. At the top we have males and the bottom we have females, and if I put this in a little bit closer, you can see the age range. So we have 30 years old, 40, 50, 60, 70, and 80. At the top here, this is normal hearing. And then as you can see, once we hit the age of about 60, we start to get some high frequency, slight to mild hearing loss. And then as we age, into our 70s and 80s, we can expect that to drop even further. So this is what can be expected as we grow up. And next, I'm going to show you what is happening in our inner ear. So this picture at the top is showing you our hair cells that are located in the inner ear organ called the cochlea. You can see they're nice in a uniform shape. They're not damaged. They're beautiful. And then once we start to hit that age of 60, they start to become a little bit damaged. So you can see they lose that uniform shape. They don't look like this anymore. They are a little bit damaged. And even though aging is one of the main factors of hearing loss, there are other things that can cause this, such as loud noise exposure, which is why it's really important to wear hearing protection when you're around loud noises. Of course, there's always genetic factors. So if there's a family of history of hearing loss, that may increase your risk. And then there's also ototoxic medications. A lot of the chemotherapy drugs can be ototoxic to the ear, so certain medications can also damage our hair cells. And then lastly, this is our ear anatomy. So if we start at our outer ear, sound is going to come in through our ear canal, past the eardrum, and then it goes through our cochlea. That's that inner ear organ I was talking about previously that houses those hair cells. And then the sound is going to go up the auditory nerve straight up to the brain. So then it's the brain's job to decode all that information. And this is why treating hearing loss is really crucial, because it can reduce your risk for dementia and cognitive decline. So with hearing aids, when we treat hearing loss, we're stimulating those hearing nerves and keeping that pathway to the brain nice and clear and active and stimulated. I always like to use the phrase, if you don't use it, you'll lose it. So just like if I were to break my arm and I didn't go to rehab and didn't do exercises, my muscles are going to atrophy. Similar things are happening with our hearing nerves, so that is why we want to treat hearing loss as soon as we can. And there are a bunch of studies out there. There's a lot done by Johns Hopkins. We'll link those below. But they actually found that hearing aid users reduce their risk of dementia by 48%, which I thought was a crazy number. So some things are not preventable, like our genetics, but treating hearing loss is something in our control and something that we can, help fix by getting hearing aids, cochlear implants, bone-anchored hearing aids. There are a lot of solutions out there to help you with your hearing loss. So if you do have any questions, don't hesitate to reach out to our clinic or comment below. We will be more than happy to assist you. Well, thank you so much for joining me in this video today, and I hope you all have a lovely day. Bye.